Good evening and thanks for joining us. We know all of you are having to adapt your lives to cope with this pandemic, and we are too. I'm now working remotely, broadcasting from a balcony in North Vancouver near my home. That's downtown, nice and sunny behind me. All of us at Global News are social distancing because of COVID-19. Now, to the major developments. All the provinces, except one, have declared either a public health emergency or a state of emergency. The U.S.-Canada border closes at midnight tonight. And here's the big picture on numbers. There are now more than 260,000 reported cases of COVID-19 around the world. There are more than 11,000 deaths, and those numbers are rising by the minute. In Canada, 12 people have now died from the virus. There's also a Canadian who died in Japan after traveling on the Diamond Princess cruise ship. In terms of cases, today we hit a grim milestone. More than 1,000 people have now tested positive in Canada. That includes at least 11 who have recovered. The bulk of the cases are in BC, Ontario, Alberta, and Quebec. There were 77 new cases in BC, 50 in Ontario, 49 in Alberta, and 18 in Quebec. Every province has detected the virus now. Though there are no confirmed cases in the three territories, officials there have joined every province except Nova Scotia in declaring either a public health emergency or a state of emergency. Now, those declarations mean different things depending on the region, but generally they give officials more powers to protect the public. Just today, Saskatchewan announced that anyone in that province who violates the self-isolation orders will be fined $2,000. The federal government could also invoke the Emergencies Act, giving it sweeping powers. That has not happened yet, but Prime Minister Justin Trudeau says nothing is off the table. For now, he's urging Canadians to stay home to help slow the spread. As Mike Armstrong reports, the federal government is supporting Canadian manufacturers to adjust and accelerate production of medical supplies.
It is an all-hands-on-deck call from the federal government. Any company that can help with the fight against COVID-19 is being asked to step forward.
We want to be over-prepared, and one of the ways to do that is to build domestic capacity and mobilizing our industry to do so.
Canadian companies that manufacture things like masks, gloves, and ventilators are being told to ramp up production. Meantime, companies in other industries are being asked to look at retooling. Can they shift to making medical supplies? The list of needed products is long, and there's competition to buy them.
Every other country in the world that is preparing like ours is trying to get those items too.
After days of intense negotiations, Canada and the U.S. have agreed to close the border effective tonight at 11:59 Eastern. Any travelers trying to cross for tourism or recreation will be turned around.
Trade and commerce will continue.
Keeping supply lines open and food and medicine moving is a priority. Truckers entering the country don't have to self-isolate. They are, however, being watched.
They are routinely being checked as they cross the border to determine if they, in fact, are symptomatic.
Another change to the border is at Roxham Road, the irregular crossing south of Montreal. Canada and the U.S. have agreed to temporarily start turning back asylum seekers, handing them over to U.S. Border Patrol. Now, the government is still scrambling to bring stranded Canadians home. There are fewer and fewer flights from some countries, and from others, none. Getting a plane in to pick people up isn't easy. Some countries are locked down.
We will have more details to share, but the first flight will be picking up Canadians from Morocco this weekend.
This has been a very rough week for the airline industry. Flight crews are working under very difficult conditions, wondering if they're putting their lives in danger. I spoke to a Canadian crew overseas today. They went last night taking Europeans home. They'll come back this weekend with Canadians. But while they were there today, they got their layoff notices by email. Donna?
Very tough times. Mike Armstrong in Ottawa, thanks. Ramping up testing is critical. It's the only way to know how widespread the virus really is. Federal money is supporting an Ottawa company that is developing a portable diagnostic device that, if successful, would provide rapid test results for COVID-19.
If successful, its diagnostic platform and COVID-19 test could be used in airports and in clinics. The device could read the test result within potentially 30 minutes.
Getting more tests, including one for antibodies to this virus, so we know who has had it and recovered, is going to be key to keeping people at work. Having so many people at home unable to work will have an economic impact unlike anything this country has ever experienced. David Akin joins me now. David, what are analysts saying about how bad this could possibly get?
Well, Donna, Canada was in an economic expansion that was its longest in history, produced an unemployment rate that was the lowest in generations. And now, forecasters believe we are about to have an economic contraction that will be the steepest in our history, possibly producing unemployment rates we haven't seen since the 1930s.
Canada's flagship airline, Air Canada, is telling 3,600 flight attendants to stand down. There will be no work for them in April. At Air Canada's Rouge airline, all flights are grounded next month, putting more than 1,500 out of work. In businesses large and small, in dozens of different sectors, and in all regions of the country, employers are simply unable to keep all their employees on the payroll. The result? More than 500,000 applications for employment insurance this week alone. By comparison, just 27,000 filed for EI in the same week last year.
I know people are anxious to get the help they deserve, and our government is working as fast as possible to support them. This is, of course, an unprecedented situation, and it's putting a lot of pressure on our system, but we're on it.
The national unemployment rate was just 5.6% last month. It is easily on its way to 8% now and may climb higher. One key focus, Canada's oil and gas sector. It directly employs nearly 70,000 in Alberta, Saskatchewan, and Newfoundland and Labrador, and employs hundreds of thousands indirectly across the country. Global News has learned that federal officials, their provincial counterparts, and some of the country's biggest energy companies are frantically working on a support package to literally save the oil and gas sector the way the auto industry was saved during the 2008-2009 fiscal crisis.
And sources close to the talks say this is a Team Canada approach to saving the industry that could yield a rescue package valued at $15 billion or more. And all sides say they hope to hammer out a deal in days. Donna?
David Akin in Ottawa, thank you. And while so many Canadians are losing their jobs because of COVID-19, Walmart Canada is hiring 10,000 workers to meet a surge in demand. The retailer says it needs more staff in its stores and distribution centers, jobs ranging from sales associates, bakery workers, cashiers, and overnight workers. Some grocery stores are taking measures to provide some separation from customers and staff. Sobeys and Safeway have ordered thousands of plexiglass screens to be installed at their checkouts. Physical distance does slow the spread, but the World Health Organization stressed again today countries need to go after the virus itself. Test people, find patients, trace contacts, isolate, and quarantine. In the United States, the restrictions there are ramping up, though public health experts say it's not happening fast enough. The U.S.-Mexico border is closing to all non-essential travel, and two of the largest states, California and New York State, are effectively shut down. President Trump has been touting an anti-malarial drug as a treatment for COVID-19. It hasn't been approved for use for that by the U.S. FDA, and today the director of the National Institute of Allergy and Infectious Diseases was asked if it might be effective as a treatment. He said no.
Is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it. It may work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it, and we're going to see. You're going to see soon enough.
There are now more than 15,000 confirmed cases of COVID-19 in the U.S. More than 200 Americans have died. As our Washington Bureau Chief Jackson Proskow explains, that country is on track towards what happened in Italy.
As New York, California, and Illinois close businesses and tell people to shelter at home, the U.S. is telling all travelers to stay away, closing both the northern and southern borders to all non-essential travel, a move coordinated with Canada and Mexico that will last indefinitely.
We want to make sure that cargo continues, trade continues, healthcare workers continue to be able to traverse that border, but tourism, some recreational activities and other things need to stop during this crisis.
President Donald Trump insists there's no talk of a nationwide lockdown, at least not yet. But the U.S. remains on the same grim trajectory as Italy. The number of cases effectively doubled overnight. The number of deaths climbed above 200.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say.
Nationwide, there's criticism that testing is still too hard to access, and confusion as to whether the president has, as he has claimed, ordered companies to ramp up production of masks and ventilators to meet a nationwide shortage.
Who's going to take care of the patients? This is a national emergency.
There's also simmering controversy in Washington. Several U.S. senators are now under fire for selling off millions of dollars in stock holdings before the markets tanked. Some attended a classified briefing on the threat of coronavirus in February. A $1 trillion economic rescue package also hangs in the balance.
We need a full unemployment insurance so that when you're laid off, you get paid your full salary, you can get on unemployment quickly.
As life grinds to a halt, it's now an anxious waiting game as America waits to see if these unprecedented measures will stave off disaster. Jackson Proskow, Global News, Washington.
We know you have lots of questions about this virus. Jeff will continue to consult with experts and try to answer them. So email your questions at globalnews.ca. On our website, you'll find a special page dedicated entirely to the new coronavirus. That's at globalnews.ca/coronavirus.